Hello, my name is Lyubov Poplavsky. I'm currently completing my clinical at Carmichael Medical Clinic in Sacramento, where I see the variety of patients. Today, I will be presenting an interesting case of a 33 years old female who presented to the clinic with a persistent fatigue and a loss of interest in activities, hopelessness, and poor sleep. This case was meaningful to me because this patient initially attributed her fatigue and lack of motivation to not being healthy. It stood out to me because it highlighted the importance of screening for mental health conditions when patients present with vague somatic physical symptoms. This case required me to think critically, consider differentials carefully, and apply a holistic approach to validate the experience while offering evidence-based treatment. Um, so my patient is SJ, was born in November 1991, 33 years old, Hispanic female, presence alone, appropriately dressed, cooperative, and oriented to self, place, time, and situation. Her chief complaint was, I feel tired all the time. I just don't have the energy to do anything. She reports feeling hopeless, irritable, and socially withdrawn. She sleeps 4 to 5 hours a day, wakes up early in the morning, and struggles to fall back asleep. Appetite was decreased. She had an intentional weight loss of approximately 7 pounds within the last 3 months. She has difficulty concentrating at work as a bank teller, and she fears that she may lose her job. She denies hallucinations, mania, or substance use. She denies active suicidal ideation. Past medical history consists of occasional headaches. She has no surgical history. She's divorced, lives with a school age child, works full time as a bank teller, no tobacco, alcohol, or drug use, limited social support, sedentary lifestyle. Her family history: mother with depression, father with type 2 diabetes. Preventive care pap smear in 2023 was normal. Last physical exam was in August 2024. She has another physical schedule last month, but she did not. She missed this appointment and saying that she didn't feel well because of her symptoms. Immunizations are up to date all over for routine immunization. Flu shot in October 2024. COVID-19 shot last was done in October 2023. No food, drug, or environmental allergies. She takes Tylenol 500 milligrams for headaches as needed. Her labs were done prior to scheduled a physical appointment. So it was done in August, and was all of the labs were normal. TSH was 2.1, cholesterol, total cholesterol was 171, low density lipoprotein 88, high density 57, triglyceride 112. White blood cells were normal. Hemoglobin 12.4, hematocrit was 40.2, platelets 245, and sodium and magnesium were normal as well. So constitutional, she experienced fatigue, weight loss, no fever, no focal deficit, psychiatric hopelessness, insomnia, and anhedonia. Vital signs: blood pressure 123/71, heart rate 76, temperature 97.6, respiration 16, oxygen 99% on room air, height 5'6", weight 131 pound. BMI based on height and weight was calculated 21.2. Physical exam: general fatigue appearance, tearful at times, no neurodeficit, psychiatric flat effect, slow speech, depressed mood, logical thought process, insight limited. For diagnostics, the screening for anxiety and depression was made. PHQ 9 was scored 19, which indicates moderately severe depression. CAD 7 was scored 11, moderate anxiety. Her labs: CBC, BMP, TSH from August was just discussed recently. And I would probably order vitamin D3 to rule out vitamin D3 deficiency. Primary diagnosis for this patient would be major depressive disorders based on DSM-5 criteria, which states that more than 5 symptoms, including depressed mood nearly every day uh, for last 3 months, diminished interest in pleasure activities, insomnia, persistent fatigue, difficulty concentrating, which interfere with daily responsibilities, unplanned weight loss, which is true for this patient. Secondary diagnosis would include generalized anxiety disorder, again based on DSM-5 criteria, anxiety and worry associated with 3 or more of the following symptoms: restlessness, fatigue, difficulty concentrating, irritability, sleep disturbance, which is also present in this patient. Another secondary diagnosis would be insomnia disorder related to depression. And this is diagnosis of insomnia is consistent with a DSM-5 criteria when sleep difficulty occurs on 3 or more nights per week for at least 3 months and cause clinically significant distress. Differential diagnosis. One of them would be hypothyroidism, and this would be very like would consider this valid diagnosis for her if her TSH would be abnormal. Because it also has this symptoms as fatigue, weight change, poor concentration, and but it could be ruled out for this patient because her TSH was normal. Another differential could be bipolar disorder. However, bipolar disorder is characterized by a mood swing from depressive mood to episodes of mania or hypomania. And for this patient, she doesn't have a history of mania or hypomania, so it wouldn't be the primary diagnosis, just this differential. Adjustment disorder could also be a differential. However, adjustment disorder would be like we can start a few weeks after the direct response to a life stressor. And for this patient, her symptoms are more persistent and more severe than it would be for adjustment disorder. Diagnostics labs were ordered and already results were done, except that vitamin D3 lab test would be ordered. Continuing to monitor labs annually.